Today we will be discussing about the benign prostatic enlargement. What is benign prostatic enlargement? This is a condition where there is a gland called prostate which lies, it's a size of walnut, which lies just below the urinary bladder, and after the age of 45 to 50 this gland starts increasing in size, whereby it obstructs the urine passage, that is called urethra, whereby the urine flow goes down and patient starts getting urinary problems. So this can be common in those people who had a family history of the prostate enlargement. So how do we come to know whether you have a prostate or not? So the first and foremost symptom in this is number of times going for urination in the night. This is called nocturia. Usually anybody passes once or twice in the night, but in these patients they pass more number of times, maybe more than 3 times or 4 times or 5 times, which leads to disturbance of their sleep. The second foremost important symptom is frequency. Like daytime the patient starts going every hour or every once in half an hour, so which also disturbs his routine daily life. Apart from this, he also develops inability to hold the urine. This is called urgency. So by the time the patient goes to the bathroom, he sometimes even leaks urine. So that is another symptom. And apart from this, gradually the urine flow goes down. So the urine which falls away from the patient slowly comes closer to the patient and sometimes falls on their feet also. So there is a narrowing of the urine stream. Apart from that, the patient, when he goes to the bathroom, he has to wait for some time and strain to pass urine. This is called hesitancy. And apart from this, the patient can have intermittency. That means the patient passes not in a single go, they passes in 2-3 goes. Like he has to strain, again passes, the urine stops, again he strains. That's how it passes. And finally, after passing urine, most of the patients will have a sensation that he has not completely emptied the bladder. This is called sensation of incomplete evacuation. So these are the symptoms which can come to a patient, which suggests that the patient has a prostate obstruction or prostatic enlargement. So how do you diagnose this? So you need to consult the urologist, who initially does the ultrasound of the KUB, that means kidney ureter bladder, which will suggest us how much is the size of the prostate. Usually the size of the prostate ranges between 12 to 20 grams. So any patient having more than this usually has a prostatic enlargement problem. And apart from this, because of the enlarged prostate, you can sometimes find postward urine. That means some urine is retained in the bladder. So that can suggest us if it is more than 100 ml, probably this patient is going into a phase of decompensation. Apart from that, patient can develop frequent urinary infections. So a patient who has this prostatic enlargement may not present directly with urine flow problem, but he can have frequent urine infections. This is one of the presentation. Apart from this, some patients do present with severe bleeding in the urine. So this is called hematuria. So that is another way of presentation of this prostate enlargement. And some people who come at a later stage, who neglect these symptoms, so these people do present with features of kidney failure, chronic kidney failure. That means they don't have a urinary symptom as it is presentation, but they can come with a lot of swelling of the body, that's called anasarca, and then they can have reduced blood, that's called anemia, and then they do have some problems like breathlessness and increased BP. That means he may be using one tablet for the blood pressure, that is not sufficient, and blood pressure keeps rising very high. So these are some of the symptoms by which we can come to a conclusion that this patient has a benign prostatic enlargement. Apart from this, there is a simple office test that is called uroflowmetry, in which there is a small western commode like thing where the patient has to stand and pass urine, and it gives us, if the flow is poor, it means that the patient has an obstructive flow which requires treatment. So, apart from this, there is a special test called serum prostatic specific antigen. So, this is done in all patients who come to us with urinary symptoms beyond 50 years, basically to rule out any cancer prostate, which is very, very important because the treatment for the prostatic enlargement would be a minimum of 1 to 2 years. So, we need to exclude cancer before we start any treatment for the prostate. So, apart from this, we do some kidney function test called creatinine, which gives an idea that whether the kidneys are normal functioning or the patient has a renal failure, as I said. And a basic test called complete urine examination also gives us an idea whether this patient has any infection or not. So, these are the basic which we do, and after this we go for the treatment. Depending on the degree of problem, there are various options. One is we can manage them with medications. There are two types of medications with which we treat the patients. One is alpha blockers. There are multiple alpha blockers which relax the prostatic smooth muscle, whereby the urine flow immediately improves within 48 hours. So, these are wonder drugs, and these are started initially. Apart from this, if the glands are more than 30 or 40 grams, we add another drug called 5-alpha reductase inhibitor like dutasteride, finasteride, which reduces the size of the prostate, and this action usually takes around 6 months to 1 year. That is why all the patients who are put on these drugs, minimum the period of usage is at least an year or 2. This is the medical therapy. Those patients who are not fit for medical therapy or who do not respond to the medicines, or patients who have frequent infections or stone formation in the bladder, or they having recurrent infections, urine infections, or frequent bleeding in the urine, that is called hematuria, and patients who directly present to us with kidney failure, these are all direct indications for going for a surgery. There are various types of surgery now we are doing. The earlier one was the TURP, that is called transurethral resection of prostate. Previously we used to use electrosurgical technique. Now we are using holmium mag laser, which is very, very convenient and can be used in any patients even who are having a cardiac problem and who are on anticoagulants or antiplatelet agents, and it is a very safe procedure, and you get a good it's almost equivalent to an open surgery. So, nowadays the preferred gold standard for prostate enlargement is laser TURP. It is also called HOLAP. After knowing about this, after this patient gets the surgery done, then there would be minor problems for a month or so, like frequent urination, or there can be some amount of urine leakage, but usually settle at the end of 1 month. And how do we can prevent this prostatic enlargement? So, there are certain things which are very important in this. Patients should avoid taking lot of fatty foods, that means all oily foods or ghee, etc., which contain high saturated fats, and they should avoid smoking, and they should avoid too much of spicy foods. All these leads to some amount of urinary symptoms. So, if you can prevent taking all these things, probably you can avoid the urinary problem. At the same time, if there is any family history of prostate problem like prostate enlargement, those people can take a tablet called 5-alpha reductase inhibitor, that is either finasteride or dutasteride, which would prevent the natural progression of the prostate and further need for any surgery or any complications which occur because of this. So, these are some of the precautions which anybody can take and can prevent or prolong the problem.